management, seizure management, and muscle spasticity management, as well as an obstetrics. I think I'm having a stroke. Obstetrics. Jesus Christ. I don't know what just happened. So, let's talk about migraines today. So, migraines are typically used to treat when you're having a migraine currently, but to help prevent it. So beta blockers possibly work on the serotonin receptors. That's what they think their possible effect is. They're used to treat migraine prophylaxis, and they're great if you also have associated hypertension, tremor, palpitations, or anxiety, because beta blockers help treat that, as well as coronary artery disease. These are typically dosed at night, and they can cause hypotension, fatigue, exercise intolerance, and erectile dysfunction, especially in men. If you have asthma, congestive heart failure, or depression, you probably shouldn't take these medications. Moving on to our anti-seizure medications, topiramate or Topamax comes first. This is used obviously to treat migraine prophylaxis, and they're great if you already have seizures because they could treat both at the same time. This works on GABA receptors, which GABA is a neurotransmitter that our body has, which kind of stops the neurons, the stuff in our brain, from firing super fast. It kind of like slows it and suppresses it, okay? Side effects associated with this are paresthesias, which is like abnormal feelings or tingling, things like that. Cognitive impairment or fogginess, and weight loss, which is pretty good. They interact with oral contraceptive pills. High doses of Topamax can decrease the effect of birth control. Divalproic acid or Depakote works on succinic semialdehyde dehydrogenase, and they inhibit that, which decreases the breakdown of GABA, which increases GABA overall. They are used to treat migraine prophylaxis, especially if you already have seizures. The side effects associated with this are nausea, fatigue, tremors, hair loss, and weight gain. Warnings associated with this are polycystic ovarian syndrome as well as liver toxicity, so we're going to have to monitor your blood for any changes with that. And the last grouping of really good drugs for prophylaxis are your tricyclic antidepressants, amitriptyline, which is Elavil, and nortriptyline, which is Pamelor. These work on norepinephrine and serotonin receptors. They're used to treat migraine prophylaxis, and they're great if you have associated depression or chronic pain, because they will also treat that. Side effects associated with this are palpitations, high blood pressure, sedation, and weight gain. Some other prophylactic options which aren't as good but can be used: SSRIs, which we've talked about before, and as well as their cyst